It's a very stressful situation when you feel that you are not able really to be present fully and share yourself with the person that you love.
Whatever our trauma was impacted us enough that the brain is trying to be able to give us a little bit of breathing room, a little bit of space. Hi there. Hi, Mari. How are you?
I'm doing well. I'm happy to be here again in another episode.
Yes, welcome back, everyone, to Letters to My Therapist. We are in season 2, and we are happy to continue to offer you resources and recommendations on navigating our relationships. So, today, Mari, we have a letter dealing with intimacy issues due to a history of trauma.
Mhm.
So that's always intense, right?
Yes.
So our writer starts with Dear Therapist, I've been going back and forth about writing this letter, but I'm feeling stuck and could really use some guidance. I'm a 41-year-old woman and I've been with my partner for almost 2 years now. He's loving and patient and in so many ways exactly the kind of person I always hoped I'd end up with. But there's one area of our relationship that I'm struggling with: intimacy. Any thoughts, or I just continue?
Well, so initially, I think it's important to realize that the intimacy in relationship is a big concept.
Right.
So we are assuming that we're talking about physical intimacy here, but there is also emotional intimacy, spiritual intimacy, intellectual intimacy. So there is a big umbrella when we
Yes.
talk about that in relationships. But when she's making the um, reference
Hmm.
to trauma, probably in this sense is talking a little bit more about the sexual part of that.
Physical and
And
sexual.
we see that that is very common. And even in the other areas, really trauma sometimes gets in the way of us being able to express ourselves in the way that we really want because we get triggered with situations. So,
Yeah.
yeah, definitely this will be very important to explore this further.
This further intimacy and what she's talking about. Well, she goes on to say, the truth is, I have a history of trauma that I've never fully addressed. In my past relationships, I either avoided physical intimacy, so there we have a little more information, or I forced myself through it, never feeling fully safe or comfortable. Now, with my current partner, I want to be close to him in that way, but something inside me always pulls back. I tense up, make excuses, or change the subject when the moment comes. I can tell it's starting to affect him, and I don't know how much longer I can avoid this conversation. So we have a little bit more information about her in this paragraph, right?
Yes, the ways that she have been trying to cope with the situation,
Mm-hmm.
and it's very common. People usually there is a lot of discomfort
Mm-hmm.
in talking about things that have to do with sex or disclosing past experience. So usually, what people do is try to avoid,
To avoid.
don't go up front there. And she mentioned things that are important, like in the past, she hasn't been feeling safe, so safety is a very important component for the healing when there is a history of trauma and when we really have to open up to somebody. So that will be
Absolutely.
important to
And
think
that, and yet it's important, right? Because we have to have safety in order to open up. So it becomes almost a catch 22 for somebody with trauma, right?
yeah, but how do you create safety in relationship? That is
That's part
also
of her question.
important.
Well, she goes on to say the problem is I've never talked about my trauma with anyone, let alone a partner. I'm scared of being vulnerable and of how he might react. I don't want him to feel like I'm rejecting him or that I don't love him, because that couldn't be further from the truth. But I also don't know how to explain why intimacy feels so difficult for me without him feeling hurt or confused. My question is, how do I bring up something that is so deeply personal without damaging the relationship? Is there a way to bridge this gap between us without him making him feel like I'm pushing him away? I love him and I don't want my past to ruin what we have. Thank you so much for your advice. Signed, Lost in Vulnerability.
Okay.
Okay.
So yeah, the first I feel compelled to thank this person for the vulnerability and the openness to disclose this, because definitely it is a very stressful situation when you feel that you are not able really to be present fully and share yourself with the person that you love. And I know how hard it was probably to write this letter.
To write this letter.
So,
Yes. As she
uh,
says, it sounds like we may have been the first people she shares this
yeah, that's why
history.
I feel thankful that she
Hmm.
trusted us. I'm talking
Me
about
too.
safety, so we want to reinforce that this is a safe space, and definitely we don't share any personal information about the person that write the letter. So now, how can she get to a similar space with her partner?
Right.
So that will be really important.
Yeah, I think it's important to help her as well as our audience understand a little bit about what trauma is, right? And how it can impact us sometimes in similar ways, but also in very unique ways. So, what are some of those? What are your thoughts on
Yeah,
trauma?
well, so trauma definitely is an experience that kind of like overcome every ability of the person to deal with the situation, is something that really is overwhelming for
Hmm.
the person that experience. And sometimes we feel unsafe, we feel in danger, we feel violated, we feel that we were not able to move to defend ourselves, like we were in a situation that maybe our survival was even at risk.
Right.
And that, as a result of that, is paralyzing. And sometimes it's not even the event. So what happened with trauma is that is the scar, is the story that we repeat in our head. And around the situation, people develop beliefs, people develop like views around the world,
Hmm.
and that sometimes they are very even like unconscious. And it's not until we are able to really process that experience, to put together the emotional part and the story, that people can really overcome all of that. But unfortunately, the way that the brain protects us
Hmm.
is putting that on the side,
Right.
and sometimes not even wanting to go there.
Hmm.
And the more time it passes, the more that gets really in the way of
Absolutely.
people experiencing relationships.
And to really help people understand that this is a self-preservation tool, right? Like you're saying, the
Totally.
brain is processing something in order to protect us. It's not something that we do in order to hurt us or on purpose, but rather it's really a way to protect us. Whatever our trauma was impacted us enough that the brain is trying to be able to give us a little bit of breathing room, a little bit of space. But as you said, sometimes it becomes so ingrained that it becomes reflexive, it becomes our behaviors, it moves way into our subconscious. And so even when we remember whatever the trauma was, it still has this lingering, right, like a residue that follows people around. And you know we essentially as human beings have two main drives, right? As Freud said, we seek pleasure and we avoid pain. So
Mhm.
anything that's going to be painful, we're going to kind of pivot and go somewhere else.
Yeah,
It sounds like our writer has been doing that for a long time.
exactly. And an element that is really important here to also explain is that around trauma, even though the brain does that and kind of like compartmentalize, there are triggers. There are little, because
Absolutely.
you don't forget.
Right.
You don't forget. You may for a while
Mhm.
maybe avoid, and your brain can protect you and kind
Right.
of like push aside those memories. But there are little elements that could trigger those memories. And that's why when she is in a similar situation, when even though the situation is nothing to do with what happened,
Right.
but it should be some elements. It could be a smell, could be a position, could be a word. uh, Anything could be a
Right.
trigger for that traumatic memory. So then that's why that gets in the way, probably, for this person to really connect and make sure that she differentiate that what she's experiencing now is
Now.
not what happened in the
Right.
past.
Right.
So definitely the partner can play an important role here in her feeling safe about
Mhm.
that. But if he doesn't know what she's experiencing, it's going to be a little bit hard for
Right.
him to be even more patient, because that could be here like an element of confusion. Now, how she decide if this person is ready to be the one that listen to her, and
Right.
if he has the tools and if he is capable to really dealing with this situation, if he could be a good listener
Right.
of the story, that is something that she will have to explore, making sure that, because he may be in a position that is a little bit vulnerable
Right.
and not be ready to really provide her with the support that she needed in that moment.
Mhm. So, what are some of our thoughts, or what are some tips we can give her on how she can initiate some of this? Because I hear two things from you. One is that the partner could be helpful in this, but we don't really know his capacity, his willingness. At the same time, it sounds like it's important for her to have her own sense of safety, to be able to trust her instincts about, is this somebody that I want to tell
Mhm.
about such a private situation, right? So what are some tips we can give her on kind of both ends of that continuum?
Yeah, I think will be important definitely to explore her sense of how safe do you feel with this person in other
In general, right?
situations in
Uh-huh.
general,
Hmm.
how much this person has demonstrated that can be somebody that can keep something confidential,
Right.
how much does he use or not use your vulnerability in the past to support you, or not necessarily in your favor. So those would be elements that, and unfortunately, when we have been in traumatic experience, we have been abused, we have been violated. Sometimes it's hard to make those differentiations. Sometimes people either trust too much or don't trust at all.
At all.
So that
Right.
your own judgments sometimes get affected after a
Mhm.
traumatic experience.
Right.
So I will say just pay attention to those details, but don't stop there.
Hmm.
I think in this case, it's definitely important to seek the help of a provider that is trauma informed, that is trauma competent,
Hmm.
because the partner cannot become the therapist.
Hmm. Right.
She will need to have a professional where she can really do a proper processing. If this is something that happened years ago and she's still experiencing charge
Right.
in the memories, and to the point that it's affecting her physical intimacy, definitely she's gonna need some trauma processing. And for that, we cannot give that job to the partner.
To the partner. Right. And I think so that's the piece that has to do with really helping herself, right, really acknowledge and then, create some ways to work through, the trauma, all of the layers of that. Eh, how, what tips do we want to give her as far as initiating a conversation with him about this? Because I think that a conversation, as she's saying, she knows she has to say something because
Mhm.
he's starting to, have some, at least
Doubt.
some level of confusion, some doubt about what's going on, right?
Yeah, exactly. Because here could be the element that he may feel that she's not attracted to him,
Right.
there is something going on, then that can create some ghost in the relationship.
Right.
So being vulnerable is a way to create intimacy too. So we would want to also emphasize that with her, having some level of openness,
Mm-hmm.
saying a little something to see how the person react, like um, I had some previous experience that were not necessarily the best, and I think this is still affecting me. You can stop
Right.
right there. You
Mm-hmm.
don't have to give the details. You don't have to say, the whole story, but you can see how the person reacts,
Yeah.
and you can see if really um, you get some reinforcement
Right.
that this person is there for you, that is really empathic and will be supportive
Right.
if you continue moving with the conversation.
Okay. So you're suggesting really going in with slowly a little bit of like a general statement, see how the person responds, reacts, and that could, either encourage or discourage depending on what they
Mhm.
get, what we do with this, right? And I think
Yeah,
always that kind of a conversation needs to be created. We want to really emphasize to her that this is a conversation that you want to create the time and the space and really think about your delivery versus it be something that, kind of is off the cuff. I'm not suggesting we overthink this, but I am suggesting that you create an environment in which you feel safe enough to
mhm,
explore if he's going to be able to handle this conversation, right?
exactly. And also explore if he will be willing to be part of the support. Once, let's say that she find a therapist and she's doing processing,
Mm-hmm.
sometimes you have to go like little by little, like step by step,
Mm-hmm.
creating that level of sexual intimacy.
Mm-hmm.
And the partner can play an important role in there and taking things slow, taking things easy, reinforcing confidence, use stopping when you want to stop, like doing this type of exercise that you say no, and having the partner being able to stop when you say
Right.
no, so you feel like you are in control again. All of that can be guided,
Right.
with a therapist, but will be important that she explore. Okay, once we cross that bridge, and once you open up, and once you have that conversation, will this person play an important role in that? Will he be willing to
Right.
play this role?
Right. And I mean, it sounds like she wants to preserve this relationship. So it does sound that honesty is going to be important for her here. And most relationships require that we take emotional risks. I
Yeah.
agree with you, Marty, that they could be small risks. They could be progressive risks. So we don't have to, do the biggest risk first. But relationships do require that we are vulnerable, as you said, that we are honest, that we are willing to share. So if she isn't, those are the kinds of things that are definitely going to impact the relationship more than whether they are having physical intimacy or not.
Yeah, and also I want to reinforce the idea that, we are sexual beings, like sexuality is part of the relationship.
Mm-hmm.
And if for some reason you don't feel like you can be fully present and you can really enjoy, will be important to do whatever is needed so you can release those tensions and you can release
Mm-hmm.
that pain so you can really be present and enjoy that part of the relationship that is so
Absolutely.
important.
Absolutely. Because it's not just him, right, that's missing out. Potentially,
Mhm.
so is she, right?
She too.
Okay.
Yeah.
So we really hope that we've given you some recommendations, some food for thought here, some ability for you to reflect for yourself as well as on your relationship. If he's as good a partner as you're feeling in these 2 years, it sounds like it might be worth the risk. Okay. We hope that this is helpful because this is a common situation for a lot of people, definitely women who have experienced whatever kind of trauma, and there are different types of trauma that impact us and that we carry with us, right?
Mhm.
So we hope that this is helpful, and that if it's not relevant to you, maybe you know someone that this episode could help and you would be willing to share. Yes, Mari?
Definitely. Yes, and always we want to remind you that we are here. Please send us your letters. Go to letterstomytherapist.com, and there is a space there where you can write to us, and we will receive your letter very confidential, and we will be sharing our thoughts here.
Absolutely. So thanks so much for joining us. We hope to see you on our next show. Our next episode is about wanting advice on how to end your relationship. This one was about trying to figure out how to stay. Our next episode is figuring out how to exit from your relationship. Join us then. Bye, Maddie.
Bye bye. Bye, everybody.